We have this thing called Kawasaki's disease, which is a grouping of symptoms that are very classic. And then we have this atypical, where they have some of those features but not all of them. And then we have this new syndrome, where what we're seeing is that they're very inflammatory. So they have high fevers that not just for a day but for many days. They're feeling very unwell, lethargic, tired, abdominal pain. We're seeing very bizarre skin rashes. So skin rashes that don't fit into any other category. And they're all different types of skin rashes. Some kids have big lymph nodes that come and go. Others have high levels of inflammation in their blood. For some, it's really a lot of abdominal pain and inflammation in the blood. So we're seeing bits and pieces of different types of inflammation all over the body, but it's not always fitting into the typical picture of Kawasaki's disease. When they have all the symptoms, the classic ones, we call it Kawasaki's, and we know how to treat that. But Kawasaki's is also something that we don't know what causes it. So we think it's viral infections or other bacterial infections that leads to this classic picture of Kawasaki's. But we don't know. So in some cases, it could be typical Kawasaki's. In other cases, it's atypical because it doesn't have all of those symptoms and it has other ones that aren't usually associated with Kawasaki's. So ours are testing negative for COVID, which is very interesting because we're testing them. We've tested them a few times, and we're not finding traces of the virus in their system at the time that they're coming in for this. In some cases, we've had parents who are testing positive and their kids are negative at the same time. So we're thinking potentially that these kids might have cleared their COVID weeks ago and are now developing. So their immune systems are so good, they've cleared the COVID, but now their immune systems are hyper acting up, and might be what we're seeing. Right now it's suspiciously connected because we're seeing much more of it than we normally would this time of year, and the other countries are seeing the same thing. The way we can make that connection is by doing these antibody tests that we don't have yet here in Quebec. But some of the other countries that are just publishing their data imminently are starting to show a positive antibody test in these children. So I think it's definitely a high level of suspicion that it might be related to COVID.